Our next speaker is Hara, and the talk is Prospective Pilot Study to Measure Baseline Radiation Knowledge Prior to Radiotherapy After Standard Education or Consultation.
Hi, everyone. Can you hear me?
Yes.
Okay, perfect. Hi, I'm Hara. I am currently a PGY4 at the University of Chicago, and I'm excited to be able to talk about our work under the direction of our fearless leader, Dr. Daniel Golden.
Full disclosure, Jared.
I have no relevant disclosures other than to say that I cannot be there today. I hope that you guys enjoy Chicago.
Sorry, Jared.
Wait, are you saying something?
I was just explaining why you weren't here in person, even though you're in Chicago. Might seem a little back.
Oh, yeah. Perfect. So a little bit of background. We know that patient education and anxiety are highly intertwined, meaning generally, the more educated somebody is about a certain topic, usually that means they have lower anxiety and vice versa. Unfortunately, we know that radiation therapy is really hard for patients to conceptualize. So to that end, Dr. Golden and our collaborators at IIT have created this graphic narrative tool, really aimed to enhance the patient education experience. So this is just an excerpt from it here. And so the overall study objective or hypothesis was, can the CBRE guide improve patient radiotherapy education and thereby reduce patient anxiety? However, the pilot study hypothesis, which is what we're going to be talking about today, is that radiation knowledge related to the radiotherapy treatment process will be low after receiving traditional radiation education materials, and counseling at the time of initial consultation and anxiety levels will be elevated. So this is a prospective cross-sectional pilot study performed at multiple University of Chicago affiliated satellite sites. The inclusion criteria for patients is broad. So as long as the patients have non-metastatic cancer and are receiving definitive or adjuvant radiotherapy, they are eligible, and they also could not have received any prior radiation, and they had to be English speaking. And we used multiple different components of our survey. One is, of course, the demographic information. We measured general anxiety, radiation-related anxiety, as well as radiation knowledge. And so all of that was stored in a secure REDCap database, and the analysis and data visualization was performed in R. So here are the demographics. The recruitment started in October of last year and is still ongoing. So far, we have 35 of the 45 planned patients, and we can see that generally the patients are older in our patient population and are diverse in a sense that a little bit less than half are African American. The education is diverse, and the cancer type is also varied as well. This is a Likert plot of the Spielberger state trait anxiety inventory state. And so each question, the patients answered each of these questions. Generally to the right, it's, patients are more anxious, and to the left, that means they're less anxious. And you can see that about a quarter to a third of the patients reported that they were feeling a little bit more anxious when it came to general anxiety. And this is the modified radiation APIS, or the, this is modified from the Amsterdam Preoperative Anxiety Information Scale. These are borrowed from our colleagues in anesthesia and modified for radiation purposes. We can see that these first two questions are related to how much information people would want to know. And we can see that overwhelmingly, about 60% of the patients want to know more about radiation, but maybe about a quarter to a third might be worried about the radiation specifically. We can see that when we look at the radiation knowledge, generally people felt pretty comfortable with how much they knew about the radiation, but there's still about a quarter in this upper half that feel that they don't know as much. However, when we see there are certain questions that even over half of people don't necessarily feel as knowledgeable about. So what are the next steps? So the purpose of all of these, the pilot study was so that we could get a better sense of the sample size required. And the next step is going to be a stepped wedge trial design, which is a type of cluster randomized trial. The primary endpoint of which is going to be patient-reported anxiety. The arms are going to be, the intervention arm is going to be using the CBRE guide, and the control is using traditional materials. And because, you know, in the rad-onc space, we typically are used to seeing randomized, traditional, like randomized control trials. So I wanted to spend a little bit of time talking about, you know, what a stepped wedge trial is. And so this is just a schematic here. In this case, there are 6 clusters and 7 periods. We see that every cluster or institution is going to start with traditional educational materials. And as each period goes on, then one of those institutions is going to switch over to start using the CBRE guide. And so by doing this, one of the reasons why we felt that more an institutional level randomization was important was because there is going to be some leakage, at least subconsciously, of providers using the CBRE guide in terms of how they might counsel their patients. The other benefit of using this kind of stepped wedge approach is that it'll help to account for temporal trends and temporal bias. So in conclusion, we see that in a diverse patient population in the community setting, traditional educational materials performed reasonably well to communicate radiotherapy knowledge, but we still see that there's a proportion of patients that might benefit from enhanced educational materials. And so efforts are currently ongoing to incorporate the CBRE guide in a prospective stepped wedge multi-institutional study. So feel free to reach out if you're interested in participating. And I'd like to thank all the collaborators for all their time and effort, and especially, you know, Dr. Golden. He's a great coach, mentor, and PI, as well as our collaborators at IIT for creating the CBRE guide. And of course, thank you to the patients for their involvement as well. So thank you all for your time.